All right, good afternoon, everyone. Thank you so much for joining our Virginia Partners in Prayer and Prevention Partner Resource webinar session tonight. We're going to go ahead and get started. If you haven't done so, please go ahead and introduce yourselves in the chat. Let us know where you're joining us from. And just some housekeeping. So this meeting will be recorded. Every single webinar that we have is recorded. As long as you register for the Zoom call, you will get the recording after the call is over. Participant lines will be muted during the call. So please feel free to use the chat box, but I'm sure we'll have time to ask some questions out loud as well. And if you need closed captioning, Zoom, there's a setting in Zoom for you to turn on. And if you need help with that, you can just send me a chat. And then for tonight's agenda, I am Jasmine Martinez and just your small host here. But we are going to hear from Erin from Virginia Breast Cancer Foundation. Given that is Breast Cancer Awareness Month, we are so happy that she is able to join us with her very busy schedule. I'm going to go ahead and pass it to her. Again, thank you, Erin, so much for joining us tonight.
Thanks, Jasmine. I'm going to go ahead and share my screen. Okay. So I've talked to this audience a couple times, but I'm going to focus tonight on more of the updates, things that are happening more recently in the past year or two when it comes to breast cancer and breast cancer in Virginia. But I am going to do a little bit of intro information and some refresher just so you have context for what I talk about later. Talk to you a little bit about our organization, then we'll get into some education, access, and advocacy issues. Virginia Breast Cancer Foundation, our mission is we empower Virginians impacted by breast cancer through access, advocacy, education, and community action. We were founded in 1991 by a group of 5 women who met at a breast cancer support group. And frankly, they were frustrated by the lack of progress that had been made because many of them were receiving treatment for their breast cancer that their mothers had received decades before. So they took that energy and decided to host a Mother's Day rally at the state capitol. And then they joined a lot of other groups in Washington, D.C., because this was before the pink ribbon was as popular as it is today. So a lot of groups were coming up around the same time. And, we keep that spirit of education and advocacy to this day because that's how we know we can make change, is by informing Virginians about breast cancer and then advocating for better policies that help affect their lives. Some breast cancer statistics in Virginia. Across the country this year, we're anticipating close to 320,000 new invasive cases of breast cancer. When I say invasive breast cancer, that means the cancer has spread beyond the part of the breast where it started. Most breast cancer starts in the duct. So, for example, it would be breast cancer that has spread beyond the duct where it starts. Unfortunately, we're anticipating over 42,000 deaths from breast cancer. I will say that I've been doing this job for about 10 years now, and that number of diagnoses keeps going up by the thousands every year, but the number of deaths has grown much more slowly. So we're getting much better at diagnosing breast cancer and also better at treating breast cancer. So yes, women still do die. Far too many women still do die from the disease, but we're getting much better at treating it. In Virginia, we're anticipating 8,200 cases and close to 1,200 deaths. Men get breast cancer as well. I usually say if you have 100 people with breast cancer in a room, one of them will be a man. So it's much less common in men, but men still do get breast cancer and they still die from breast cancer. It can be difficult for men who are diagnosed with breast cancer because they show up at a women's imaging center. Everything is pink. They're asked, "Oh, are you here for your wife?" And all that can be really othering for the men who are seeking treatment. Thankfully, there's some work now done by some really great national groups that are trying to get rid of that stigma for male breast cancer. How is breast cancer usually detected? Usually it's the person themselves or their partner who finds a sign of breast cancer. The clinical breast exam happens usually when the woman goes to their OBGYN every year for an annual. Mammogram is the best actual test we have right now, screening test for breast cancer. Now, for a while, the U.S. Preventive Services Task Force had set the age of recommended first mammogram to age 50. They have recently lowered that back down to 40, which is where basically all of the professional groups have been, even after they raised the age. 40 is really the best time because women's breasts tend to be easier for a mammogram to take pictures of. Generally, when we're younger, our breasts are more dense. As we get older, our breasts become a little bit more fatty. Some of that glandular tissue starts to thin out. So if you take a mammogram, if you do a mammogram too early, you can't really see anything. But starting age 40, generally the mammogram can take pretty good pictures. And what they realized when they raised the age to 50 is that they were missing a lot of breast cancers in younger women, particularly younger Black women. So the age was lowered back down to 40. So age 40 at average risk. If you have breast cancer in your family, for example, if your mom was diagnosed with breast cancer at 45, you should start getting your mammograms at 35, 10 years younger than your relative was diagnosed. It's important to have a conversation with your doctor before the age of 40 to find out when you should start getting mammograms. Breast ultrasounds and breast MRIs are also used to find breast cancer, usually in conjunction with a mammogram. Mammograms are great at taking a picture of the whole breast. Ultrasounds give the radiologist a better picture of what's going on in a specific area. Usually, if someone has a mammogram that is abnormal, they will have you come back in for a diagnostic mammogram. So that's another mammogram, and usually an ultrasound as well to take a better look at what the suspicious area is. There's also a breast MRI. This is different than an MRI you would get, say, if you messed up your knee. You're actually laying on your stomach and you have your arms up for 45 minutes. So it can be an uncomfortable position. So it's not as well tolerated as a mammogram. And same with the contrast from an MRI. You don't have to get any medicine or anything injected into you with a mammogram, but you do with an MRI. So MRI will take the clearest pictures of what's going on inside the breast, but they're harder for a person to tolerate, and insurance can be difficult in approving an MRI. So that's why we stick with the mammogram. But breast and ultrasound and breast MRI are really important when it comes to the actual diagnosis of breast cancer, particularly if someone is diagnosed with breast cancer. Getting a breast MRI can help the surgeons figure out exactly where the tumor is for removal. So, reminder of what you're looking for. Short answer, any change to the breast. Long answer, we've heard about lumps. Sometimes there's pain, there's swelling, a rash, changes to the nipple, discharge, change in direction. Basically, if there's something that on your chest that looks kind of funky to you, is not normal to you, then that's something to mention to a doctor. One risk factor I'm going to talk about is age. Now, I mentioned mammograms at age 40. That is when breast cancer risk is a little bit higher, obviously, than when you're in your 30s, but not as high as it is post-menopause. Menopause is really the dividing line that doctors look at for breast cancer. Postmenopausal breast cancer is more common and more likely to be of environmental causes or something that just happens rather than something that is genetic. So if you're going to the doctor and they ask you about your family's breast cancer history and you say, oh, yeah, my grandmother had it, their next question is going to be, how old was your grandmother when she was diagnosed? Because they hear, oh, my grandmother was diagnosed at 70, they're going to be like, okay, well, that happens. It's not necessarily going to affect your risk. But if you say, my grandmother was diagnosed at 42, they might ask you some more questions about other members of your family, and might decide that you need to start screening earlier. I mentioned dense breasts earlier, and this is a good example of that. So the breast on the left, these are mammography images. The breast on the left is a very fatty breast. The breast on the far right is much more dense. The trouble comes with dense breasts in that potentially cancerous tissue and dense breast tissue, that fibrous glandular tissue, they both show up white on a mammogram. So it is difficult sometimes for a radiologist to see what is healthy but dense breast tissue and what is potentially cancerous breast tissue. So women who have dense breasts, they might get more callbacks, which means they go in for their screening mammogram and then they get a call back that they didn't get a really clear image, or they need to come in for an ultrasound because they're not sure about a certain place. And that can cost a lot of money, and takes a lot of time, and can be concerning for women who aren't, if it's not explained to them why they keep getting called back. So if you do have dense breasts, a 3D mammogram or tomosynthesis is really the best first line for you, because a 3D mammogram takes pictures in a different way. It makes it easier for the radiologist to see what's dense tissue and what is potentially cancerous tissue. There's also some thinking that maybe if you have dense breasts, you might have a slightly higher risk of developing breast cancer, but that is not as clear of a distinction as it is harder to find breast cancer in dense breasts. Dense breasts, as I mentioned earlier, is also more common in younger women, and this is becoming more of a concern because we're seeing more younger women. That means women under the age of 50, a lot more 40-year-olds, even women in their 20s and 30s, being diagnosed with breast cancer. And that's not just in the US, that's worldwide. We've seen an uptick in recent years. Again, not a huge amount, but it's enough to make statisticians look at it, be like, something's happening here. So, and unfortunately, our best tool, the mammogram, it's more difficult with women who have younger breasts. I also bring up pregnancy and postpartum because unfortunately, we are seeing more of an overlap in the pregnant women, postpartum women phase, and women who are getting breast cancer. Because some women are having babies later and we're getting breast cancer diagnosed younger. So there's a lot more overlap in the population than there has been historically. So generally, doctors like to wait at least 6 months after someone has finished breastfeeding before they get a mammogram. Now, definitely circumstances are different, but if you are someone of average risk and maybe you're close to 40 and need to start getting mammograms, but you're also recently postpartum, talk to your doctor and see if they want you to wait another couple months, just to be sure that your breasts are back in a stable place before they go ahead and do a mammogram, just because it's going to be less uncomfortable for you, and a more clear image for the radiologists. Ultrasounds are the ultrasound for the breast, so it's the same kind of thing as the ultrasound for pregnant women. So they can be done very easily while pregnant or nursing. There's no concerns about radiation or anything like that. There's very little concern about radiation with mammograms as well. Pregnancy and breastfeeding, it's obviously caused a lot of changes to the breasts. And generally, historically, when a woman would talk to her doctor about changes to her breasts in that pregnancy postpartum period, they would say, don't worry about it, just a clogged duct, or you have mastitis, we'll give you some some medication, and it'll clear up the infection. Those are by far the most common issues that pregnant and postpartum women deal with their breasts. However, breast cancer can show up in this population as well. So if you know someone who's going through this and has some concerns about their breasts, make sure that their doctors, encourage them to have their doctors do their due diligence to make sure, oh, it is mastitis. It cleared up in a couple weeks with antibiotics. Okay, then we can move on. But if it doesn't clear up, further tests need to be done. Just a slide about common myths about certain items and behaviors that cause breast cancer. I will say that my high school government teacher told me it's the aluminum in deodorant. That's what causes breast cancer. They've actually done a lot of studies around this, and they found no relationship between aluminum and antiperspirant and development of breast cancer. So I also hear a lot about underwear, bras, size of breasts, all those things. They have nothing to do with development of breast cancer. I'm also going to put in a plug for clinical trials. Deaths from breast cancer have gone down a huge amount, even in the past 20 years, because we've had more drugs developed to treat the disease. We're having women who have metastatic breast cancer, and that's stage 4 breast cancer, the type of breast cancer that is terminal. Some of them are living 10, 15 years with their disease, as opposed to dying within 2 years, because we have new medicines that have been developed. And we only get new medicines because of clinical trials. Virginia is really lucky. We have 2 National Cancer Institute designated comprehensive cancer centers, which are really like the top rated cancer centers in the country. We have 2 of them, VCU and UVA. We have a lot of other hospitals that are also doing clinical trials. So we have a lot of research happening in Virginia. If you participate in a clinical trial, you will get your disease treated. You will either get what is the current standard of care, which is the same thing you would get if you went to your local cancer center to get treated, or you'll get the current standard of care plus whatever the new thing is. Either way, you're going to get a lot more attention from a medical team than you would if you were going through your local cancer center. So that's one of the benefits that we hear a lot about of people participating in clinical trials. They feel like they have a lot more people holding their hand through the process. So one huge thing, a couple big things about access. If you don't have health insurance in Virginia, there's a program called Every Woman's Life. If you have health insurance, you get a screening mammogram that is covered, no out-of-pocket cost. If you don't have health insurance, call Every Woman's Life. It's free breast and cervical cancer screenings available throughout the state. It is a very important program. It serves about over 6,000 women a year in Virginia, and honestly, 20,000 women would qualify for the program. We just don't have enough money to cover everybody. But this is a very important program. So if you or somebody you love is without health insurance, please utilize Every Woman's Life because it's a great resource. And if you're diagnosed with breast cancer after you've been evaluated through this program, then basically an application for Medicaid gets fast tracked so that you can go ahead and get your cancer treated quickly. So I mentioned, the process of if you have an abnormal mammogram, you get a callback. What I haven't mentioned is that oftentimes when say we need you to come in within the next week or 2, and it's going to be $500. And honestly, that's probably if you have good insurance. Screening mammograms are no cost if you have health insurance, but any follow-up testing that gets you to a potential diagnosis costs money. You pay copays and coinsurance. Depending on the size of your deductible, if you've met it yet, that's going to be a big impact for a lot of people. So uh, BBCF, we've had something called our diagnostic fund in Southwest and Central Virginia for the past couple years to help people who are what we call underinsured. They have health insurance, but they can't afford going through this testing process. We help cover the costs of the testing because we want people, most of the time, people are going to be getting to peace of mind faster. Most of the time, if they get a call for a follow-up, they're not going to end up diagnosed with cancer, but sometimes they are. So sometimes women get the call that they need to come in for a follow-up and they think, oh, $500 in 2 weeks. Well, the car needs new tires. I don't know if I can do that. The kids have soccer. I don't have any breast cancer in my family. I'm probably okay. I'm going to wait. And then we have women who end up getting diagnosed at a later stage, which is at a much less treatable, and there are fewer options available for treatment for women who are diagnosed at later stages. So we don't want that to happen. So we created our diagnostic fund. And then also this year, after 3 years of hard work, we got passed by the General Assembly a bill that covers, that makes insurance, if you have health insurance, your diagnostic imaging tests will be available at no out-of-pocket cost. So starting next year, January 1st, or whenever your health insurance plan rolls over, if you have certain kinds of health insurance, so then there will be no out-of-pocket cost. What do I mean by by certain kinds of health insurance? Your plan has to be state regulated. So easy way to think about that is if you're a state employee, if you get health insurance through the marketplace, and some other small business insurances and some larger businesses. The best thing that we can tell people to do is next year, talk to your insurance company, talk to your HR to find out if your plan falls under this new law. Because if it does, then if you get called back for a diagnostic mammogram, you don't have to pay for that test. If you get called back and if an ultrasound is included, you don't have to pay for that test. An MRI, you don't have to pay for that test. Additionally, under this new state law, supplemental screenings are covered at no cost. Supplemental screenings mean that if someone has dense breasts, it's usually recommended that they get an ultrasound along with their screening mammogram every year. Or if someone's at high risk of developing breast cancer, it might be recommended that every 6 months they alternate getting a mammogram and getting an MRI. If they're over 40 and they have health insurance, then their screening mammogram gets covered, but they do have to pay for the MRI. So under this law, if your plan qualifies, you do not have to pay for those supplemental screenings. So again, this only applies to imaging. So it's just the ultrasound, MRI, and mammogram. It wouldn't apply to biopsies and pathology. So there still would be some out-of-pocket cost. But really what we've learned from a lot of surveys is that it's the imaging testing that keeps people in debt for a little while throughout their diagnostic process. So we're really trying to help solve that problem. So in Virginia, next year, as soon as your plan rolls over, you might qualify for not having any out-of-pocket costs for diagnostic testing. So please talk to your HR and most importantly, probably your health insurance company to see if you qualify. I will also mention that we're learning more about some new federal guidelines that have that are coming down next year as well, that apply to people who have an abnormal finding in their screening mammogram. So if you show up for your regular screening mammogram and then they call you back and say, hey, we think we found something, we need you to come in for more tests. Our understanding is that those following tests don't cost anything, don't cost that person anything out of pocket. We're learning more about how that's necessarily going to apply, but that applies to federally regulated health insurance. So that means Medicaid Medicare, TRICARE. Uh, it's a much broader population. There are still going to be some people who fall through the cracks. For example, if you have health insurance that's not qualified under the state law that we passed and you find your own breast cancer, for example, you find your own lump and then tell your doctor, hey, I think something's going on, that would not qualify you under the federal guidelines. So unfortunately, it's still going to be complicated and a web, but we are going to have a lot more people covered at no cost than we've ever had. And VBCF is planning to keep our diagnostic fund for those people who do fall through the cracks. I know that is a lot, and I'm happy to try to answer any questions as well as I can. But really, the best people to talk to are going to be your insurance company and your HR to learn more. Let's see. We have a lot more information on our website. We're working on getting some pages up on our website about the new health insurance law in Virginia and the new guidelines that are coming down from the federal government. So you'll be able to understand a little bit more about how that might affect you and your healthcare. If you're looking to renew your registration and maybe get a new license plate, just want to put the plug in for the pink ribbon license plate. It actually helps us raise money to do the work that we do. We get $15 for every plate that is purchased, and it really does help us out a lot. So please consider. And I just have a couple quotes to inspire people to take what they've learned and move forward to help advocate for people who are experiencing breast cancer. So with that, I'm Erin Steigleder. My email is on the screen, and I'm happy to try to answer any questions you might have.
Thank you, Erin. That was wonderful. I know I learned some things. I have a question myself, but if anybody has any questions, please feel free to unmute yourselves or type it in the chat box and I can read it out loud for Erin. But as we know, it is breast cancer awareness, and me and Erin were talking about how busy she's been this month at all the events. Um, is there anything that you found yourself consistently saying at the events, like something that people are really wanting to know, something that you can leave with our audience today?
Yeah, I mean, I think the thing that struck me is that we're still getting questions about when people should start getting mammograms. We're hearing people being afraid to get a mammogram because they've either heard that it's uncomfortable or they think, oh, it's an X-ray, that's radiation. Doesn't radiation give you cancer? So I'll kind of unpack that a little bit. Yes, a mammogram is an X-ray. The amount of radiation involved is the same as you taking a flight across the country. So there's very little radiation involved, and it's similar to amounts that people expose themselves to regularly. And this really is the best way we have to find out what's going on internally inside the breast. Now, for being afraid to get a mammogram, one great thing that I came across at a community event was I had two friends coming up to me, getting some information. One friend said, like, oh, I haven't started getting my mammograms yet. I'm nervous to do it. And her friend looked at her and said, I'll go with you. We'll set up an appointment. Like, we'll get coffee beforehand or we'll get lunch after or something like that. Like, I'll go sit in the waiting room with you. Don't worry. It's no big deal. Like, I'll be there.
Right.
So if you have someone in your life who is expressing some fear about going to get a mammogram, offer to go with them. Make it more of a social experience because it can be kind of isolating. You're scared by yourself. You're seeing a machine that you maybe never seen before. People in your doctor's office you never seen before. It can be a nerve-wracking experience because you're also afraid, what if they find something? But I really would encourage you to Be an encouragement for your family members and ask if you're nervous yourself, ask someone to come with you. That's totally okay. They can sit in the waiting room until you're done. You can go do something fun afterwards. Um, Another thing that I'll mention is that if you have not had a mammogram before, you are more likely to get called back after your first mammogram, just
Mhm.
because there's no images for the radiologist to compare. That's a lot of why we ask people to come back so often, like every year, so that the radiologist can compare, like, what does this image look like this year compared to last year? Are there any changes that look concerning? Are the things that are potentially normal changes for aging? Things like that. But if it's your first mammogram, they have nothing to compare it to. So they're going to be extra cautious to learn a lot more about what's going on inside, what things you might have been born with, how your cells are. They're just going to be more cautious. So people who are nervous anyway, and then they're going to call back for their first mammogram, they're like, oh, that's too scary. I'm not going back. Please go back. Please go back every year,
Yes.
um, and stay on top of knowing your body in between. Mammogram is once a year. You're with your body the other 364 days. So it's important to pay attention to what's going on, and don't let fear keep you from acting, because we are doing so much better when it comes to treating breast cancer. My mom was diagnosed in 2021. She's doing fine. Um, Now, granted, she's someone who had health insurance, had resources, wasn't working, had a lot of time to deal with things. She was diagnosed at the end of September. She had finished her treatment before the end of December. So
Mhm.
she was done in 3 months, surgery and radiation. Um, so if it's caught early, it's much less involved. There's less surgery, there's less medication. You can decide whether or not you do certain things to treat it. You have more options. So it's always better to check, try to get it diagnosed early so that you can get it done and
Right.
move on with the rest of your life, which a lot more women are able to do now, thanks to research. So that's really the main message: is don't let it keep you from going to the doctor. You got to go.
Yeah, that's awesome. Thank you so much. And thank you for the work that you do, because I know you've been a part of this for a while. So thank you so much again for your time tonight. We still have some extra time in our call if anybody wants to come off mute. Any questions, I'm sure Erin will be happy to help. Or if anybody just has a comment or anything, we definitely have the time before I close this out. Um, I don't
Also
see.
mention that we have, you can order free materials
Yeah.
from our website. Go to vbcf.org, go under the Take Action menu. It's like free resources for Virginians or something like that. And we'll send you a box of brochures, reminder cards that have that image that I showed earlier of the signs and symptoms to look out for, stickers, things like that, no cost to you. Um, so if that's something you're interested in, please check out our website and help us spread the word.
Yes, and I've already shared that link a couple of times, so I'll make sure to put that in the follow-up email to everyone. I don't see any questions. Erin, thank you so much. You did a wonderful job. Um,
Thank you.
yeah, I'm gonna just go ahead and close this out for the night. Thank you guys so much, and everyone have a wonderful night. Please continue to join us every third Thursday of the month, and we'll see you guys next time. Have a good night.
Thank you.
Thank you.